I am Dr. Brian Wood. I am a geriatric psychiatrist. I specialize in treating patients with memory disorders and other forms of cognitive disorders. So I am practicing currently at the LewisGale Medical Center in Salem, Virginia. I'm a native of Virginia. I was born and raised a little bit north of Richmond. I went to Hampton-Sydney College. I graduated from college there. Went to medical school actually in West Virginia. And then came back to Virginia for both my residency at Eastern Virginia Medical School and my fellowship in geriatric psychiatry was here in Roanoke, Salem, through the University of Virginia's program. After finishing medical school, I initially went into practice briefly with a group in Virginia Beach, Virginia, and they had taught me during my residency. They were a group that had kind of broken off from the medical school group. And part of my work there was to supervise residents in a small community services board setting. That was very enjoyable to me, and I think that what it helped me to realize is that there wasn't enough of that I wanted the education to be really a central part of my career. So ever since then, I've worked in medical education kinds of systems. I've started out working for the state and working on their medical affiliations with several medical schools and medical students and residents and things like that, and developed that more and more. Was the residency director of the University of Virginia's program here for a few years, and then have been overseeing medical education in the psychiatry department at the VA ever since. So I'm looking forward to, continuing to do that, starting a new program, and getting people excited about having education in mental health. The thing that inspired me to become a physician is just the physicians that I had treating me and my family when I was a child, and kind of seeing that the connection that they had with my family. I think that's something that has really stuck with me, is that relationship, and I try to certainly replicate that in my practice with my patients, as I think that's a very, very important part of being a physician, and I think that's one of the things that has inspired me over the years. I constantly tell medical students that I work with this, that if you had asked me what I wanted to go into in the third year of my medical school career, I would have told you anything but psychiatry. I liked every part of medicine, and I think as I went through that, not even knowing that I was interested in psychiatry, when I hit my rotation in psychiatry, that's all I wanted to do. Kind of drive that I had to treat people that really needed care. And that's what I saw in my rotation in psychiatry, is really people that were so much in need of care, and there were not that many resources to help them oftentimes. And so, I think that was one of the things that really inspired me to go into psychiatry, and then later on particularly into geriatric psychiatry. And I got to be good friends with the person that was teaching me. I still keep in touch with him, as a matter of fact, and see him periodically. But that was the thing that inspired me to go into psychiatry, was just that personal experience with patients. I became interested in geriatric psychiatry actually very early on. I was always the one that would volunteer to go to the nursing home because I enjoyed it. Part of that comes from my own background of being very close to my grandparents and growing up with them and enjoying, their company. But I've always enjoyed being around those patients. It was something that I thought was needed. Most people go through their general residency and go straight into a fellowship. I did not do that. And by the time that I actually did train in that a few years later, I was doing a good bit of geriatric psychiatry and knew that that was exactly what I wanted to do. I wanted to see that group of patients, all the time and work in that setting. And that was probably one of the most interesting times of my education, was having the opportunity to go back and do that and not have the responsibilities of being an attending physician, but being a trainee again. So that was something that I really enjoyed, and ever since then, that's what I've done clinically. I live on a farm. I enjoy that. I have all sorts of animals: chickens, pigeons, pigs, horses. I enjoy having the horses. My wife and I enjoy riding the horses. I enjoy spending time with my family. I have 2 boys. Spend a lot of time with them and enjoy that tremendously. Enjoy fishing, activities like that. One of my hobbies that I really enjoy is working with dogs. I have pointing dogs and have them, train them, hunt with them. That's one of the things that I very much enjoy. And I work with my sons, help me with that. Lots of things that we do together as a family, and that's basically what I enjoy doing.